Hey everyone, my name is Annah Taylor and I am a senior at USC studying psychology, and I recently joined the Early Social Development Lab, and I'm super excited to be a part of this research that's helping so many families. And I actually want to be a therapist, so I'm going to be sharing some different therapeutic techniques and resources that can help support children and families affected by autism. I'm going to talk about occupational therapy, speech therapy, physical therapy, and ABA therapy. I know sometimes it can be difficult for parents to understand all the different types that are out there because there's just so many, but this series will explain all the different types and what they're used for. So today I'm going to start by talking about applied behavioral analysis, which is also called ABA therapy. Basically, this is a behavioral intervention that focuses on a child's behaviors and their learning. It works to improve a variety of different skills like communication, speech, socializing, academics, mostly through a one-on-one intervention with an ABA therapist. And it helps to engage the parents so that they can learn and practice skills with their child, and it helps them progress a lot faster outside of therapy. And a large part of these services involves understanding why children might be having certain behaviors and how different consequences, either positive or negative, might be shaping these behaviors. And the ultimate goal is to increase behaviors that are helpful and decrease ones that are harmful or can be negatively affecting the client's ability to learn and socialize with others. The use of positive reinforcement is a super important technique that they use in ABA therapy, which involves rewarding children after they've done something that you want them to continue doing. So in sessions, this often involves the therapist modeling or prompting behaviors during playtime and then immediately rewarding the child once the behavior is followed through. This causes them to want to repeat the behavior over and over again, and the more that they're praised, the more that they will likely engage in that behavior. There's many other techniques and skills that are used during ABA therapy, and they're all tailored to the specific needs of the child. And there's also a lot of different environments that ABA can take place in. So some children prefer to go to the center and others prefer to be in their home environment. This summer I was actually interning with an ABA therapist, and it was really amazing to see the bond that forms between a child and their therapist. It's super beneficial for development, and it also allows there to be a steady person in the child's life. Children with autism tend to have a lot of different people coming in and out, and it's great for them to have a familiar face that they know that they can trust. Literally every time we would go work with the kids, they would be jumping around, so excited that we were there, and even when the session was over, they would be asking us over and over again when we're coming back, and it was just so fun to do this internship and really rewarding to see the children's progression. Luckily, a lot of insurance companies actually cover it, so I'm going to leave some links to websites that you can check out if you're interested in learning more about ABA therapy in the area. And next, I'm going to talk about speech therapy.